I would give hundreds of talks and say, I'm here for you, whatever you need. We can answer your policy questions. We can tell you what others are doing. And folks would look at me like, that sounds nice. I have no idea how you could help me. Like, no idea.
Having been on the receiving end so many times of let me know if I can help you. And I will literally try to say it kindly, I don't know, you tell me if you can help. But that gets back to the, do good things.
I had to basically give them a list of here's what we provide. Here's the services that we can do. Like, I don't sell widgets. I just sell my mind,
Just flipping that to say, I have figured out how I can help you because I know, again, back to Senator so-and-so, Commissioner so-and-so, that you're focusing on the following. That is a two-way street that I think can really meet more in the middle.
That's when folks started to say, I want that, I want that, I want that.
I'm JB Wogan from Mathematica, and welcome back to On the Evidence. One recurring topic for this show is how to ensure that scientific research and other data lead to improved public well-being. In other words, how do we make sure evidence leads to action, which then leads to better results in people's lives? For example, past guests have talked about how they communicate their findings with different audiences across different mediums, such as blogs, social media, podcasts, and policymaker briefings. On this episode, you're going to hear about two related models for making research more useful by establishing ongoing, trusted partnerships between researchers and the public sector. Part of the idea behind these models is that relationships are critical to whether evidence informs decision-making or goes neglected behind the paywall of a peer-reviewed journal. Our guests for this episode are Jenni Owen and Cynthia Osborne. Jenni is the director of the North Carolina Office of Strategic Partnerships, which is part of the North Carolina Office of State Budget and Management. She has held previous roles in government and academia, including serving as the policy director for North Carolina Governor Roy Cooper, and before that, serving as a member of the faculty at the Sanford School of Public Policy at Duke University. Cynthia is the founder and executive director of the National Prenatal to 3 Policy Impact Center. She is also a professor of early childhood education and policy at Vanderbilt University. She previously founded and directed the Child and Family Research Partnerships, a nonpartisan research group at the LBJ School of Public Affairs at the University of Texas at Austin. In the past year, Jenni and Cynthia contributed to a special issue of the Social Policy Report, a journal of the Society for Research in Child Development. That special issue focused on strategies for creating productive partnerships among child and family researchers, practitioners, and policymakers to make child and family policies more evidence-based. My Mathematica colleague Jill Constantine joined me for the interview with Jenni and Cynthia. Jill is a senior fellow at Mathematica with deep expertise in education policy research, including research practice partnerships in education. And I'll flag a few specific elements of her experience because they'll be relevant to the conversation. For 4 years, she directed the What Works Clearinghouse, an online resource funded by the U.S. Department of Education that reviews and summarizes scientific research to answer the question, what works in education? She also has supported the Mid-Atlantic Regional Educational Laboratory, or REL. These laboratories are administered by the Institute of Education Sciences at the U.S. Department of Education and involve collaboration between researchers, school districts, state departments of education, and other people working in education policy to help generate and apply evidence with the goal of improving student outcomes. We recorded this interview at a conference hosted by the Association for Public Policy Analysis and Management, or APAM, in the fall of 2024. At the time, the governor of North Carolina was still Roy Cooper, but as of January 2025, Josh Stein has been sworn in as the state's new governor. If you're new to Mathematica's On the Evidence podcast, please consider subscribing. More information on how to subscribe on your podcasting app of choice is available at mathematica.org facebook.com/ontheevidence. I hope you enjoy the conversation. Jenni and Cynthia, welcome to On the Evidence thing. Thank you so much for being here today.
Thanks for the opportunity.
Yeah. So I wanted to talk about this special edition that you both contributed to, and Jenni, you edited, of the Social Policy Report on Government Research Partnerships. And I was curious, what inspired the special edition, and why did you think this was the right time to focus on government research partnerships?
Great, and agree. Thanks for having us. Cynthia and I have worked together off and on, so nice to be sitting next to each other having a conversation like this. So that was the first issue of the new editorial team and new editorial board, for which Cynthia is part of, for the Social Policy Report of the Society for Research and Child Development. And we thought it was a great opportunity. Lead editor Lisa Berlin, Dr. Lisa Berlin for the University of Maryland, and I and the board thought it was a great opportunity to highlight a few themes that we hope the Social Policy Report will feature throughout our tenure, at least, as editors in the editorial team. And those are this cross-sector partnerships need, the increased demand for that. We knew collectively people like Cynthia and the others who contributed to that journal, to that piece, people who were really great fit. And the timing, I think the timing's always good. And the difference maybe is that we had people involved with this issue or this report, the series of reports that represent philanthropy, which is also part of the mix we can talk about if we get to that, represent philanthropy, represent academia, represent government, and wanted to start out from the beginning with featuring those three sectors and the opportunity for cross-sector partnerships between them.
You've been working in this area for a while. Is part of the timing also, you've been working for Governor Roy Cooper, it's the end of his second term, you wanted to make sure that lessons from that experience were well documented and shared?
Definitely, but that was really more serendipitous.
Okay.
So it wasn't any pre-planning on my part, which is, this is 2024, let's make sure we get something out related to the conclusion of Governor Cooper's second term. It really was the convergence of the people, the opportunities. Vivian Sang with the Foundation for Child Development contributed, Diane Halsey contributed, and so really just a great combination of people and work that I knew they had done recently that could be, when I say repurposed, I don't mean just change the title and put it into another cover, but change the title and modify it to be for different audiences like those that would read the SPR and those we're trying to reach that we often don't get and I think we collectively don't get the opportunity to reach as much. But
Gotcha.
The timing was there, and timing in terms of the actual year was nope, I came onto the editorial board, we were discussing what to do for our first issue. This seemed like a great combination of people and just communication.
So let's jump into some discussions around how these partnerships work. In one of the articles, you indicate that government research partnerships have tremendous yet largely unmet potential. That line really caught our eye. I think many of us experienced that. So I'd like each of you to just talk about one or two, either barriers or what is it that's limiting that tremendous potential.
Sure. I think that there are some great success stories. I know that in my experience, I have worked with some state agency officials that really value both the development of the research questions together. What is it that we need to learn about this program that we're implementing or a new direction that we're going? They want to be involved in the discussions throughout. They're hungry for the results. They are, open to what the results actually are and want to change practice or direction because of those. They are interested in, learning not just whether a program works, but for whom and under what conditions. And that's when it's right. That's when I, as a researcher, really understand what the goals that the state has and how they are thinking, how they measure success. And I am attuned to that, and they understand what motivates me. And I have worked for some state agencies in which they are very afraid of what evaluation results might lead to or bring or say about what they're doing. There's a lot of often political pressure, and you'll work on something for a very long time and they'll get the results and basically want to sit on them. And that's not good for anyone. It's kind of a waste of our time, if you will, and it's not useful to help those that need to be served by it. So, when folks are open and courageous with research and evidence and findings, it can really be a great situation. When there is a mismatch between how much folks want to inquire and explore and then use that information, then that's, I think, when it goes off the rails a little bit.
Yeah, I agree with all of that, which won't surprise Cynthia, since we've talked about this before. I would say a couple other things. Often people point to the disconnect coming from timing mismatch. So Cynthia's working on a research project. She'll know she's different, but most researchers may have a long horizon. So in 3 years, I can tell you the results. And if, for example, I were a policymaker, I can't wait 3 years. I need it next week. That's a problem. Training, just different ways of being trained to be in different sectors, and language, just sort of basic disconnect between language. But I think there are other things as well, because you can actually adjust for those things to some extent. We're having this discussion during the APAM conference, the Association for Public Policy Analysis and Management conference, in case listeners don't know, viewers don't know. I bet if we walked into any room during a research presentation and said, how many of you here, researchers, are doing policy relevant work, everybody would raise their hand. That's why they're here.
Exactly.
I think if we then said, great, how many of you have talked with anyone in government about the policy relevant work that you're doing or planning, et cetera, maybe somebody would raise half of a finger. And that's not to disparage the research community, but having that sort of co-production, planning, all of that happen from the start, it just doesn't usually. So that would be one constraint that I think is very much something you can overcome. And the other is funding. I mean, research costs money. And working in government costs money too, obviously. But if I'm one of those policy relevant, researchers doing policy relevant work, and I really want to put energy into working with my government partners, probably can't do it for free. So unleashing some kind of philanthropy might come in, and government funding itself, unleashing some resources to make these partnerships more the norm and not the exception, I think is one reason why they aren't more common.
Can I just layer on to the funding issue? Because I agree with you that funding is such a requirement to make this happen. When it's funded by the agency that you're partnering with, that can create a different dynamic. And it can go both ways. I've had positive and negative when the departments are funding them. When it's neutral funding, then the researcher is more in the driver's seat, and they may want to steer the car in a direction that is somewhat different than what the state really wants. And then the state may be more inclined to, or less inclined rather, to share all their data or to invite them in quite as closely. So who funds it can really influence the type of partnership.
Yeah, so I'm gonna have a follow-on question about that too, but if I go kind of put together the way you have both characterized it, starting when you characterize, Cynthia, that when it works great, it does sound like there's a lot of trust there. Then, right? If right at the beginning, and add in what Jenni talked about, if it can start at the beginning and it's trust, either because the relationship was there already, or you figure out some other way to generate trust quickly, that's pretty critical. And I can see where, okay, maybe the relationship's there already, but it's hard to generate that trust kind of right from the start if it hasn't been an established relationship.
I think that's such a crucial part. And I think trust needs to be earned. And part of the way that you earn that, at least when I work with different agencies, is, like I mentioned before, I really have to understand what is it that they are rewarded for doing? What is their primary mission, their goal? What's their language? And what are the outcome measures that they're held accountable for? And they have to really understand that I'm going to be transparent in my approach, and they're going to fully understand everything that I'm doing. We may not all love what the outcomes say, but there shouldn't be any sort of disagreement about the approach and the method that we took to get there, so that we're going to believe what the outcomes say. But trust is a really ongoing thing that has to be built. I agree. Initially and maintained over time.
So we've been talking in general terms about research government partnerships, but you both have firsthand experience leading partnership models. And I thought it'd be helpful for the listeners to hear a little bit about the models that you work in Tennessee and North Carolina. I don't know who wants to start, but
Sure.
Jenni?
Yeah, thanks. So I'm, as I said, in the North Carolina Office of Strategic Partnerships. We started at the initiation of Governor Cooper, recognizing how much more the administration, but the state government broadly, could do to capitalize on the incredible research expertise we have across North Carolina's institutions of higher ed. So public universities, private universities, historically Black colleges and universities, community colleges. I really want to emphasize community colleges can be part of this too. It's not just the four-year institutions. We care about institutions outside the state, but we care more about those inside the state because that's where the researchers obviously are likely to have even a longer term, potentially, investment and commitment to what state government is doing. And we developed a model. We did not go into it saying we were going to develop a model. We did not go into it saying there's going to be an Office of Strategic Partnerships. So it was a staff of one to start to look at how to leverage these partnerships across sectors more and better. And the demand quickly emerged from state agencies in North Carolina, so both Cabinet and Council of State Agencies. And what we did was basically go to leaders of the agencies and say, not what are your research questions, not do you want to do a randomized controlled trial, but what are questions to which, if you had the answer, you would be in a position to make better decisions for the work you are doing. And we started, as it happens, with the Department of Revenue and the Department of Environmental Quality. And I just say that because people might assume we would start with others. And we started with people who we really thought would get it and wanted to do some proof of concept work initially. We developed, I won't go into the details, but just to give you a sense, we help the agency. So where we are now is we help agencies, if they aren't already defining and articulating research questions, we're happy to help them do that. And so some they may just say, we have a problem with how long it takes to do X, or COVID and wastewater, or whatever it is. If they don't know how to articulate the research question, super smart people do a lot of things really well. This isn't necessarily what they wake up and think about every day. Help them do that. We then have basically a template with 10 or so questions where we say, what will you do if you get the information you want? What decision will it help answer? What kind of expertise do you think you need? Is there data available to help you do this? If not, would you be willing to help generate the data? What's the deliverable you're looking for? Do you need it next week or do you need it in 6 months? So we get a framework for what they're trying to learn, and then we work to basically look across the institutions of higher ed in the state, find a group of people, sometimes it's 10, sometimes it's 30, sometimes it's somewhere in between, and set up opportunities, actual virtual opportunities for that entire community of interested researchers and the potential agency partners to engage, talk about not one at a time, but as a group, to talk about the opportunity, and then the process goes from there. And I'm happy to go into more detail, but that's the basics of it. And we try to make it very open source, very accessible to anybody. We record these sessions, which some people think is unusual, but that means if you couldn't come, you can actually learn from what that conversation was about what the agency is trying to get from the research opportunity and so on. But I'll stop with that. I'm not sure if you want me to go into more detail.
Yeah, I could ask lots of follow-up questions, but
happy to.
Yeah. At some point, I'd be curious to hear how you think about that as being different from, say, an RFP, like a formal RFP, or. But Cynthia, why don't you talk about the prenatal to 3 policy impact center?
Sure. So ours is quite different from that, and I've known Jenni for a long time, and I know what you do, but to hear it described was really helpful, actually. And ours was more organic when it started. So before I moved to Vanderbilt, I was at the University of Texas at Austin and ran a center there that we founded called the Child and Family Research Partnership. And partnership was really the key word because we entered into partnership with different state agencies and large nonprofits with the goal of both evaluating the programs or policies that they were implementing, but also to provide consultation to them on what was possible. What does the research tell us about the needs of the families that they're serving? What does the research tell us about what others are doing that might be implemented? So we provided kind of both tell them how things are going, as well as what might be possible. And this was built somewhat informally, just by relationships that emerged, and then me participating in any sort of meetings that I could to understand what the agencies were doing. And we worked from home visiting and child welfare and child support and pre-K and others. We moved in 2019. We started in 2019, officially the Prenatal to 3 Policy Impact Center, and moved to Vanderbilt about 2.5 years ago. And the Policy Impact Center has a slightly broader, a much broader approach than to work just within one state. So now we do a similar sort of thing with at a 50 state plus DC, or we call it 51 state perspective. And we still do this original research where we are working with state agencies or large nonprofits to either evaluate what they're doing or to help them understand what's possible. But we have a different angle as well, which is we identified through the most rigorous evidence that's available what policies have an impact on the lives of infants and toddlers and their parents. Our whole goal is that all children thrive from the start. And so we've created this tool for states, this guide for states. We call it a roadmap. And we work with state leaders if it is their goal to try to implement some of these policies, to provide both policy analysis, data analysis, landscape scans, any sort of education that we can to help them to meet their goals. So we are both doing original research, we're identifying what it is that works, we're monitoring what all states are doing, and then we're working closely with elected officials, advocates, administrative staff to help them to meet their goals.
So when I was reading the special edition of the Social Policy Report, I was struck that one model is in academia and one is based out of state government. And I was going to ask you which setup is better, but that might be a little unfair. I imagine you might. But what do you? Maybe a more neutral question is, what are the trade-offs with each setup? I think I'm more familiar with the ones that are based. There are other ones that are based out of academia, but what are the trade-offs?
Well, we haven't been on the other side of the aisle necessarily, but.
I mean, in government's better, obviously. So,
Of course.
So we'll just get that out of the way. No,
But you turn to the researcher, so
I'm kidding.
it takes us
I mean,
both, right? That's the deal.
Totally. I did this from the university side before. No, I shouldn't say side actually, because I think that comes up. It's like the side. The point is to not be one side or the other. I think neither of us can do it without, neither sector can really do this as well without the other. We can certainly do it without the other. That happens all the time. I would say some of the trade-offs are, well, I'll just say a couple of things about why being inside government helps, but I don't think you have to be exclusively inside government. So I think having somebody, and I think like Cynthia is a good example of that. I mean, she has built, and her team has built relationships with people in government. That is, I'm not going to, says like what's best, but it matters that somebody knows who the messenger is. So I think that is as important as what sector you're coming from and speaking from and emailing from and so on. I think the difference from when we started, as opposed to being in academia, when we started this endeavor within North Carolina, is we're literally all part of the same organization. So even if I'm in a council, if I'm in the Office of Strategic Partnerships and you're in the Department of Revenue and you're in the Agricultural Commissioner's office and so on, we're all in state government. And so there's not a question of, well, what am I really doing this for? Am I doing this to publish? Am I doing this to get tenure? No, I'm inside government with you. But then, as you said, we turn to researchers to help answer a lot of these questions. So we do have an internal to government role called the Evidence Advisor that we created and we were able to fund with philanthropic support. It was a test. It's working really well. Could have a whole nother podcast about the sort of, I don't want to say pros and cons because I don't think there are any cons, but the challenges and benefits of that. Similarly, with philanthropic support to get it started. We created a philanthropy liaison position within government, which is unique nationally. I wish it weren't. I think it's something that every state and lots of localities and so on could benefit from. But I think starting from the same institutional home and saying, we need this for state government. We're all in state government or local and federal. It's not I as a researcher having a research agenda, but then bringing that to researchers and having the agendas sync, I would say, and from the get-go be aligned is what makes the combination of the two the best. But
Yeah.
you might want to add to that.
I think what I would add is being at a research university brings some credibility to our findings that can be useful for state government. It can be useful for an elected official or an advocate to say, researchers from XYZ University have confirmed this, or they did this. We are not cooking the books. This is what they're telling us. To have an outside perspective can be really helpful. However, what doesn't work is if I stand outside and basically, knock on the door and say, here, I did this. Let me bring this to you and show you because now you should change everything because of something that I've done. That sort of relationship doesn't work very well at all. It's like you said, we have to kind of come in and work with you in tandem. And that's when the partnerships can really be healthy. But if we're kind of just working in parallel and hoping that we cross paths at some point, that doesn't work quite as effectively.
I want to add one quick thing to what Cynthia said. I think if, just using Cynthia as a real example, if she comes and says, I did this after the fact and didn't do the co-production, didn't do it ahead of time, which is often the case, I think that can work. It's not ideal, but I know it's not what you do, but I think it can work if you say, because I know Senator so-and-so, Governor so-and-so, Commissioner so-and-so, you said yesterday, last week, whenever it might be, that you deeply care about this particular issue. Here's the thing that
Sure.
I wrote and did in research that respond. If you show that you have an awareness of the context as opposed to just here's my new journal article, hope you enjoy it, which I don't say sarcastically, that happens a lot. Then I think even not having a relationship beforehand doesn't mean you can't get traction with research.
Yeah.
But you have to show an awareness of why are you sending, kind of the why now? Why are you sending this to me now? There has to be a reason for that, not just that it happened to fit your timeline for doing research.
And you probably don't want to send a journal article.
At all, right?
No, never.
Yes.
You want to send one page
Right, thank
that's
you for- yeah,
written
exactly.
with very
That's a
lay
whole other
language.
Infographic.
Yes.
Another conversation, yeah.
I will just say really quickly that there's an analogous situation in communications for a research organization that I find where if we just put out a press release, reporters aren't going to pick it up. You have to know ahead of time who are the reporters that would be interested in this. You have to reach out to them directly and tell them, hey, there's a new report that's come out. It's directly relevant to your work. I'm familiar with your beat. I think this would add to your coverage. And we find that is a much more successful strategy for media engagement than just, spray and pray, put it out on the wire and
100%,
hope somebody picks it up.
Exactly.
Absolutely.
I think that's exactly right. That's a great analogy to what we have to do effectively.
Yeah, so following on some of these topics, work we have at Mathematica, but a lot of organizations have this kind of work. This is our work through the regional education laboratories, but it's these structures where it's in some ways the best of like what you put out there. It's funded elsewhere, the federal government's funding it, and for us, the way it's structured, the whole structure is pretty specified that you have to work in partnerships, as in like you have to provide your proof that state or government or agency is with you on this and wants to look at this and this is a problem they want to solve together or policy they want to do together. So it's like all the good, like a very good setup, seems to have all the ingredients, neutrally funded, but a good requirement to make sure the researcher isn't like, but here's what I'm really interested in. You really have to have that partnership. So all good. The two things that create trouble, one of them, getting back to one of the trade-offs, we'll be very excited. We'll have something going. It'll be great. And then there'll be some turnover. And it can be with a state commissioner of education or it can be down. And that, I feel like it's heartbreaking for everybody. So that's kind of the most, I think, common challenge we face. And then, again, depending on the level you're talking about, if you get down to local districts, sometimes you can have a lot of turnover. So I kind of wonder how partnerships survive that. And then the second thing will be, so we'll be all excited and we'll have our researchers and we'll have our folks in the state, and the researchers will know research and no evidence. Oh, and so we think these and these and these are important questions. And man, you'll be there with the agency and they'll be like, no. These are the things that are actually challenges for us. I love that, you're starting with the revenue service and things like that around, where are the challenges. So both kind of keeping the people all together, how do you manage that? And then what do you find if your researchers and your government, your agency staff, they just sort of don't seem to be together on what the pressing issues are?
Well, I can, especially with the second question on that, it took me a while to figure out how to balance that. And I'm not saying that I always do it well. But what we tried to do was to make it so that, again, my government partner understood what I was rewarded for, and I could understand what they're rewarded for. And I mean literally like what you're promoted for, right? What you have to do for your job. And so we would try to develop a research program that would ensure that we could get all their answers, all their questions answered, that they could get the feedback that they needed in a timely way, that if they needed to change the program, we didn't want to wait 5 years out and say, well, we knew it was going off the rail in 5 weeks, but wanted to let clean research play out. We made sure to meet the needs that they would have, and they would understand that we need to ask sometimes additional questions on the survey, or there will be publishable papers, because our responsibility is also to advance the field of knowledge so that we better understand who our families are and how to serve them. And getting a clean evaluation is really hard. We often did not get that out of most of our research practice partnerships, but we did learn a lot about who our families were, what their needs were, what the challenges were for implementing different programs and so forth. And so we could negotiate that there was room for both of us to be able to learn, and without changing the budget or asking them to, pay for anything additional. But I don't know if you have other ways of approaching that.
Well, I think the last thing you said, everything you said I agree with, but we don't always agree. So we will disagree if we need to, but so far we haven't at all, I don't think. I think the last thing you said about, I don't remember exactly what the word, the sort of room for both of us to do what we need to do, or both sectors to do what they need to do and are most equipped to do and rewarded for doing. So picking up from that, I think it's not, if either sector is approaching it as an all or nothing proposition, like either I get to do my question or Cynthia, the researcher, gets to do her question, it's not going to work. It's just not going to be a partnership. And so, but if it is, I have a research protocol, or Cynthia has a research, I have a research protocol, we're going to interview early childcare providers and ask them these 7 things, whether you like it or not. I think that's totally appropriate. But also ask, is there something that you state or you superintendent or you whomever would also like us to ask? So I think it's that, and then we asked before, JB, about what makes this different than an RFP. Interestingly, I think this is actually part of it, which is like get us in the room, and often now it's the virtual room, which I think is one. Nothing was good about COVID, but I think one thing it did help us do is make sure that people in whatever state, locality, anywhere across the state, world literally can be in the virtual room having these conversations. It does make it a lot easier to raise possibilities, think about the possibilities, challenge each other on the possibilities. And the reason your RFP comment came back to me is we've been in conversations with, or we have helped to facilitate conversations between a state agency who has definitely articulated the research question, bring in the researchers to talk openly, again, as we said, with all at once with the agency. And we've had a couple scenarios where potential research partners have asked questions about what the agency thinks they want to know that has made the agency say, oh, actually, hang on, we need to actually think about this a little bit more. It's not that our question is wrong, but we need to think about what we really might do and how getting an answer will help us make better decisions. So that's been goals, because you don't jump right in and put in an RFP proposal to say, okay, state, I'll do what you want, or okay, feds, I'll do what you want, but have an opportunity for some engagement between the sectors before you land on the specific, as you said, the methodology, the path forward, whatever it might be. So that's been hugely helpful.
I wanted to just touch on the turnover question, and because it's sometimes not just that the folks who you're working with will leave, it will also be that other folks within the organization may have a different appetite for this, and they may control all the data. And, I always tell my students not to even think about trying to engage in any of this for a dissertation or something like that, because the realities can be very tough, and you can be going down a path, everyone's on the same page, and then lawyers have a really important role, but often they interpret things like FERPA or HIPAA in a much more narrow way than, things like that. So this stuff comes up. So to Jenni's point, having an RFP that I've participated in or read some that are like, you have to do exactly this sort of thing. I don't like those at all. And I find that the contracting stage, the thing that's most important is access to data, and that's going to be clear. And what happens in the event that someone, goes away. And those are the things that we can try and negotiate and discuss ahead of time to plan for, but you can't obviously plan for all the things that are going to happen. But I find that that's really an important conversation to have up front of what might happen, these kind of the known unknowns.
Yeah,
Right. So some of our listeners work in government, and I know the social policy report, my guess is that its readership is mainly academics. I could be wrong about that, but I wanted to tease out any lessons, anything that a government audience should know about these models and how to make them most effective.
You want to start on that?
Sure. I think you're right that the readership is largely from academia. I'd like for you to be wrong. And so one of the reasons we did that was we wanted to have people, again, from different sectors sharing versions of the same story and sort of advocating for the same cross-sector work and the impact it can have and the fun it is, honestly, and the value it can have sort of spread across levels of government and types of research institutions. So welcome your thoughts about how we can get it out there in a broader and more strategic way. I think as far as, lessons learned or what I would want people to know, I would say, pay attention to the perspectives of different sectors, your own and whatever sector or sectors you're not part of, when it comes to trying to use research to inform, influence, advocate, whatever it might be, policy, government, decision-making, and so on, in whatever branch it might be. The other is, and I genuinely mean this, it's like partnering is fun. It's hard, but it's fun, and it's a whole lot more interesting, I think, and has a whole lot more potential for impact if, going back to what we've been saying, the sort of co-production, co-development, co-design, and so on, of what the possibilities might be. And then I would just say, as far as truly sharing, we have, as I was saying before, we've recorded now 49, next month will be 50, what we call monthly connects, that are sessions that anybody can come to. They're all recorded except maybe the first one in 5 years ago, this month or last month, that does some of this information sharing and strategy sharing and sort of some nuts and bolts of how to do this. There's obviously not one way. That's part of why we're both, I think, talking together today. But to have some real resources for doing this kind of work, so that if you're interested in doing it within your own institution, however big or small, or as an individual researcher, there's no guidebook, but there's a lot of guidance out there, not just from us, obviously. And I think everybody that contributed to that report is a source of guidance, and their partners are sources of guidance across sectors.
I should say, anyone who's listening who works in government and is interested in that issue, it's free and open access. Yes,
yeah, that's right. Thank you for saying that.
And we can add links to the journal, to the issue in general, and the specific articles that we're describing today in our show notes, so people will be able to find it easily.
Thank you.
I think I would add a couple of things of, how is it that government can really engage in this and make it as effective as possible? And I think it's partly, one, not every researcher is kind of designed, to do research practice partnerships. And that's okay. There are some researchers who are just excellent at research, but they're not as interested in translating their findings for real world impact or dealing with the messiness and nuance that comes with these partnerships. And that's okay. Everyone has a role to play. So you can't expect everyone to participate in the same way. I think another one that's really important, that's hard sometimes for state governments, nonprofits, others to understand, is that when they're working with researchers, they're not buying a widget. The contract that you use to buy a refrigerator or to have someone put in your parking, like that is very different than when you are contracting with a researcher. And when we work in a university, our university is going to protect our intellectual property. That's all we have, right? And so they're going to protect that. So it's more akin to hiring a doctor or a lawyer or a consultant in a way, right? That is going to come and guide with you, work, co-create, but guide you through answering some questions. And so it's often a little concerning for state agencies or nonprofits to hire folks who aren't going to just do what they say. And that is, that's where trust has to come in. It's where relationships have to come in. It's where conversations have to come in before the contract's written. And, we are different than just a contract for hire or buying a widget. And that can be a little bit uncomfortable, but once that's understood, it can really be a great partnership and both advance the field of knowledge, which is what researchers, again, have to do, but really improve the lives of folks by improving programs and policies.
I'll say one other quick thing. One of the things we emphasize a lot is not making the complicated the enemy of the simple in this sort of thing. So this costs money, it costs human resources, it costs other types of resources, but it is not a budget-busting endeavor to help field, seed, stimulate, and so on partnerships. So that's one thing I would say. The other is, I think government, we've been talking a lot, about what research can do sort of differently and better. I think the onus is on government as well and one of the things, again, we've tried to do, and I know others tried to do, is just open lines of communication. And not, the I don't know who to call refrain, which is very, very common. There's a way that you can make it easier to know who to call. It doesn't mean that person will have all the answers, but they might know the person who does. And so I think just having a sort of spirit of communication, spirit of responsiveness, spirit of, instead of not responding when a researcher says, can I have your data for the following? Respond and say, well, maybe, but are you going to do anything with that data that might be helpful to me too? I mean, having a conversation often doesn't take long to at least land on some potential point of common interest. And maybe there's not, and then don't waste each other's time. Maybe there really isn't a possibility for a partnership. That's okay too, as Cynthia was saying.
So one of the supports federal government, philanthropy, other entities try to provide is, because we know agencies, governments are looking for, well, what do we know? What are the evidence-based policies? So they've put a fair bit of resources into, some of them are federal clearinghouses to provide, objective, systematic assessments of what the policy says, and then tries to make the dissemination easy in that at least it's free. I'd say accessible to mixed success. So I wondered if that's something you guys leverage in your partnerships. Is that something, or at least the researchers leverage to bring in? Like, how important is that as a resource, potential resource?
I think it has a lot of potential. And yes, they're in these various fields. Within my center, we started with a clearinghouse so that we could show we have reviewed all of these policies. Here are the ones that have demonstrated evidence. I think the approach is right. And because I spent over a decade in home visiting, there's also some challenges or opportunities that we could actually try to take advantage of to make it stronger. So one is that when we do an approach in which we say, here's an effective program, and we put it on the magic list, and now all you have to do is just go to the magic list and pick a program and implement it, and it's going to make the whole world better. That we literally found that there were some communities implementing a program for 3 and 4-year-olds, and their idea was that they're going to improve health outcomes at birth. Those aren't aligned, right? And there were others that were doing ones to focus more on health outcomes at birth, but they thought that that was going to be school readiness was their main goal. And so I do think that there's an importance for an alignment between what the goals are of the state or the community and how the programs or what the clearinghouse, what the guidance is. I think that the other thing that I have some concerns about with the clearinghouse approach is that once you're in there and you're labeled effective, you as a program don't have an incentive to be innovative or to address, to even evaluate yourself again, because you don't want to have null results or inconsistent results. And I think for the benefit of families, programs need to be able to take risks and be innovative and to think about, well, what are the big problems affecting families today that might be different from when we invented this program 30 years ago or so? So I'm very much a fan, think it's the right approach, and we have to be mindful that we don't just say, that's it, we got it, we never have to look at this again. And I think it has to be an ongoing process.
Yeah, I mean, the only thing I would add, I really appreciate you bringing it back to like the families and what are we doing this for to begin with anyway. The only thing I would add, just from a very practical standpoint, the fact that it's there doesn't mean that I know that it's there or that I know how to use it properly.
Right.
And so and I don't have I could give some quick thoughts about how to do that more and better, but I think others can too, but I think it's a lot of potential and not yet realizing that potential, that it almost needs to be, I think bring it back to the dissemination question a little bit, or the communication question, which is, it almost feels to me like somebody's job or part of somebody's job needs to be, I'm paying attention to the clearinghouse, I'm paying attention to who in policy and practice are doing things that would benefit from this clearinghouse or the subset of this clearinghouse, and proactively, I'll say feed that to them, but help them see that it is there. And training may be a little bit too strong of a term, but help them understand how it can benefit them. Because there's so many examples of as we all know, the sort of online tools and mechanisms and so on that are beautiful, and a lot of work went into them, and they're technologically strong, and they're not coming anywhere close to seeing their potential realized.
Yeah, what I loved about this question when you said you might ask about it was that I think of these partnership models as being very active and relationships driven, and the evidence clearinghouses are very passive, or at least they can be. Maybe their sort of default state would be that way. But it is interesting to think about how you might merge the two, or how it might, like you're saying, like maybe there are monthly meetings like you do with OSP, or maybe it's case studies. I think that Results of America and their economic mobility catalog, they do some stuff where they are not only updating their clearinghouse, but they're actually trying to make people aware of the updates they're making and how they might be useful to specific audiences.
I wanted to just piggyback on this point about being passive or being intentional. When we first started the Policy Impact Center, we had the roadmap, we had the clearinghouse, we had all sorts of information and tools, and I would give hundreds of talks and say, I'm here for you, whatever you need. We can answer your policy questions, we can tell you what others are doing, and folks would look at me like, that sounds nice. I have no idea how you could help me, no idea. And then hired someone on my staff who wasn't a researcher, who convinced me finally, but it was a tough one, that I had to basically give them a list of, here's what we provide, here's the services that we can do. I'm like, I don't sell widgets, I just sell my mind, oh my goodness. It was, as a researcher, you don't really put yourself in the other folks' shoe of, don't you just want to tap into my expertise? I'm being flippant, but when we could start to describe, well, we can do a benefit cost analysis for you. We can do a landscape scan to tell you what everyone else is doing. We can run numbers based on your estate and tell you, when we could tell them what we could actually do for them, that's when folks started to say, I want that, I want that, I want that. And so just kind of that passive versus intentional.
No, having been on the receiving end so many times of let me know if I can help you. And I will literally try to say it kindly, I don't know, you tell me if you can help, not me, but help. But that gets back to my colleagues and I, obviously I'm not speaking for all of state government, but I can't tell you what press releases to read. I'm just saying read them and find it, et cetera. So thank you for that. But I think it really is a question of, on a positive, people, and I sort of made a note to myself earlier, it's great that we're having this conversation. The conversation we're having is about two sectors, and again, I would include philanthropy and three sectors and probably more that want to work together in better ways and more often and et cetera, long terms, do good things, for government and for people who are served by government and so on. But let me know if I can help you, I think just flipping that to say, I have figured out how I can help you because I know, again, back to Senator so-and-so, Commissioner so-and-so, that you're focusing on the following, and having the onus on government to make sure it is clear, what our research questions are, what the priorities are, read the budgets and so on. I think that is a two-way street that I think can really meet more in the middle and have fantastic impact.
I think that's right. That's been this similar experience working through the regional education labs. It's a structure that allows you to do two things, right? Go to your regional agencies and partners and ask, what are your most pressing issues? But the as important step two we do is, and how can we help you figure out the information you have or what you need or what your data sources, we really do work with them to develop. And then what's the strategy around addressing that, right? Because you're right, everybody, the government agencies have a good sense of what they're facing, but for them to think through what would all the steps be of what you can bring. Yeah. But it's true, that's a pretty special situations that you have the resources and you have the flexibilities and you have the right researchers who want to talk and engage that way.
Yeah.
So, but it's wonderful when it works. So I think looking for more of those situations.
I will say, since you happen to mention the regional education labs, as it happened, we did a series of just 3 recorded sessions with the SERV, the regional education lab at UNC Greensboro, on, I'm not going to get the title exactly right, but it was basically helping state agencies with program evaluation. So it was for state agencies primarily to help state agencies understand how program evaluation, what that is, how it could help them, and did it in such a way that it's back to the learning, so that when someone says, how can I help with that, it actually means something to them. But it was with one of those, one of the labs.
Yeah.
I just wanted to add to that, though, because that education of what an evaluation is, I think can be really important. There are some folks who work in state agencies who are incredibly smart and knowledgeable about what an evaluation would entail. And there are others who are incredibly smart, but are not, never really experienced this. And I always talk about how important it is to have the conversation both with my team and the state about the trade-offs and the benefits and the burden that we're going to put on both the state agency and the families, and what we're going to benefit from doing that. And that's where education can really come into play, that if they can understand the ways that we can get a lot of information with as minimal of a burden as possible, and the benefit will be this way, those are conversations that are really important to have. But folks often hear evaluation and they hear randomization, which a lot of state agencies are very hesitant to do. They see it as withholding resources.
Or assessment.
Or that you're, yes,
do,
exactly.
Right, yeah.
And so, when you can, there's, I think some kind of education and conversation is important to better understand what that actually means.
All right, so another question, kind of going back to some things you said about lessons learned. So we are coming out of a period of really an unprecedented infusion from the federal government into state and local governments to deal with economic recovery and everything else they did to come out of the pandemic. And as part of that, there was we saw on the ground innovation about all kinds of things people tried about, kids in school and, meeting the needs of communities. But as part of those resources, there was encouragement to actually try to learn and evaluate from some of those innovations. And I would say to very mixed success. We saw everything from probably some very good learning from the innovations, but also sometimes just some overwhelmedness, both at the volume of the resources, what to do with the resources, and then what was happening in their communities. So I wonder if you all could speak to like, what is the lessons learned from that, or what is the promise of trying to make sure we leverage these partnerships to learn when those kind of innovations or changes are happening?
Well, I agree with you that there was a lot of opportunity, but we may not have capitalized on it as much as we would have, because, as you're well aware, when things flood the field, it's often hard to conduct a real rigorous evaluation because everything is changing at once. And you don't have some sort of phased rollout, or you're not randomly assigning anyone to get things, and one policy is not changing at one time. Everything is changing. So it's been a difficult time to wrap your head around how to say, let's evaluate this one program. And because not everything else is being held constant in any way, shape, or form. And it's within the pandemic context, and we don't know how generalizable that is. I do think there's still going to be some studies that are going to be coming out. We learned a lot from the pandemic. We learned a lot about how federal American Rescue Plan Act dollars, the child tax credit. We learned a lot about some of the big changes that happened that we could measure on a population level. And I still think there's a lot more that we can learn. One of our jobs is just to monitor all the evaluations that are going on, within our space. And there are still those that are going to be coming out more. But Jenni, you may have a lot more insight into what you guys learned in North Carolina, especially, but it was hard to control, I would say.
Yeah, no, I agree with that. I agree with all of that. I think it's not as if the opportunity's completely gone. So I think it's important to highlight, just reinforce what Cynthia said. It's not, if we didn't do it, we can't do it. I think learning about why is that? Why didn't we collectively fully, as you said, fully capitalize? And hopefully there will never be another pandemic like that, but there will be something that floods the field, as you said. So are there some process components that the funders or the grantees can put in place to be prepared for the flooded, probably a bad example to use right now, but the flooded field, to prepare to evaluate? And then the third thing I would say, to account for the fact that we know it's going to come in droves like that. So what do we do? Because that's not going to get any easier, I think, unless there's some changes in process. And then the third thing is sort of back to the all or nothing proposition question. Even if you can't do the most rigorous evaluation that one would want to do with the perfect set of conditions, doesn't mean you don't learn anything.
That's right.
As we know. And so what I would say, and this is what we would say for the partnerships as well, share what you learn. Back to what JB was talking about, how do you share that in a way that makes, that people can receive and so on, is a whole nother communications component. But don't, back to don't keep quiet what you've learned, at least make it accessible. And I think if you were to go around in a very simple way, say, literally probably every local, state, federal agency, school districts, public health department, what did you learn from fill in the blank? They would all have something to share, and something that is research. Not everything would be research-based, but some of it would be research-based and evidence-based. And I think that's something I don't think that's been done. I'm not sure who I think should do it. That's potentially a lot of work, but I think there's a lot of learning that has happened that is not in the public sphere to take advantage of.
I would add 2 examples of places that I think that we actually have learned quite a bit. And one is how when we reduce administrative burdens, that it actually allows for folks who are eligible to get the resources they're eligible for, and it doesn't increase fraud. And we got to see that out of necessity. People couldn't come into an office, so we had to be more based online and so forth. And it allowed folks to get their resources and not, it didn't lead to increases in fraud. I think another is when having to do with teleservices. So we did a study early on about home visiting programs. These are designed to go into the home and meet with the mother and the child, or the parent and the child, and they couldn't do that. And there was actually a lot of good that came out of this natural experiment. They could be more flexible. They could figure out some ways to accommodate, they didn't need a whole hour. They could do a lot in a lunch break by telephone call. And then there's some limitations because you need to see the baby and so forth. But home visiting programs are now trying to figure out, how do I incorporate this moving forward, right? So I think there are a couple of, those are just two examples where out of necessity, we studied it and we got from it what we could, and it didn't necessarily lead to randomized controlled trials for it. And another thing is that now some of those programs are more, they've been up and running, they're more established, and it's probably a better time to start to evaluate them anyway. And so we can think about any of those things that are kind of long-standing. And then there's going to be money that is actually going away. And from a research perspective, that's another quasi-experimental design. It's what we were able to see with when the child tax credit went away and child poverty goes back up, right? So we can be creative. We can still learn from all this.
So I want to wrap up with a forward-looking question. Can each of you share something you're working on that built on your previous work around partnerships, something in 2025 and beyond?
I would say this is a great example. Thanks for inviting us to talk with you, and I think and share our different sort of institutional homes and vantage points from doing this work. I think the more we can do to embed this, help people from different sectors understand that it's doable. I think the word messy is great. That shouldn't scare people off. It might scare some people off, as you said. That's okay. But figuring out a way to share what we have learned about cross-sector, I don't just mean we, but collectively, again, we, about cross-sector partnerships. It's a pretty hot topic right now, which I think is great. I don't think that's going to go away. And then the other would be, and I hate to keep bringing up investment, but investing in it in different ways, whether it's human resources, financial resources, having flexible pots of funding to pull on so that government agencies can support research in this kind of arena, I think has a ton of promise and extends into and beyond every level of government, every type of research institution, and really every topic. We're topic agnostic in the work that we do, and that this, you could fill in the blank. I know you have a very, a deep focus. So I think whatever your vantage point and whatever topic or topics you focus on, a lot of what we've said applies and has, again, limitless potential. So trying to embed that and share it as much as possible would be my 2025 vision.
That is exciting. So as I mentioned early on, we create this annual roadmap. And this year in October, we put out our 5th annual roadmap. And so right now, we are in the process of doing a 5-year look back, if you will, to be able to really understand the progress that states have made over the past 5 years in terms of implementing evidence-based policies and what that means for resources for families. And it's a different strategy of being able to new information for states to be able to use as they make the case for what policies they want to work toward in the coming session, 1, 3, 5 years in the future. In December, which is only going to be a couple weeks away right now, we are bringing a team from every state of about 6 people who represent diverse perspectives. Some are looking at parent and child health, some early learning, some economic security, some are elected officials, advocates, agency administrators. And we crowdsourced the agenda. So we're going to spend one day celebrating all the progress that states have made, allow them to really look at what they've done, and then to think about how they're planning for the future. And we're spending 2 days on with different sessions that really address the questions that they say that they have, as they are, the big challenges that they see in front of them. And we're doing peer-to-peer learning. So we'll have kind of a research perspective to level set. This is what we know about it. This is what everyone's doing. Then we have states that have actually tried this and they've been successful or not successful, or, don't repeat the mistakes that I made sort of deal, but that peer-to-peer learning. And we are going to then have every state, as they are leaving, document what is it that they still need, what's the type of assistance that they need from the field, from researchers, from others who are, more in the kind of technical assistance realm. And that's going to give us a really good sense of what hopefully those who are advocating for infants and toddlers and their parents are going to need. And that's a different approach for us so that we can be more strategic in how we think about the information that we provide for them.
Fantastic. All right. Well, I hope that both your 2025 vision / New Year's resolutions go exactly as planned. Thank you so much for joining us.
Thanks for having me.
JB.
It's been a really great
Thanks,
conversation.
Cynthia. Thanks for what you do.
Thanks to my guests, Jenni Owen and Cynthia Osborne, and thanks to my Mathematica colleague, Jill Constantine, for joining me as a co-host for the conversation. In the show notes, I include links to the homepages of the North Carolina Office of Strategic Partnerships and the National Prenatal to 3 Policy Impact Center. I'll also include a link to the special edition of the Social Policy Report, where Jenni, Cynthia, and others discuss partnerships between government and researchers. It's open access, so you do not need to pay to read the articles. As always, I want to thank you for listening to On the Evidence, the Mathematica podcast. This episode was produced by the inimitable Rick Stoddard. If you're a fan of the show, please consider leaving us a rating and review wherever you listen to podcasts. To catch future episodes, subscribe at mathematica.org/ontheevidence.